Hello and welcome. I'm Michael Berman, and I'm here today with Brian Doyle, Vice President of Enterprise Sales at Rectangle Health, to discuss how software solutions like our Practice Management Bridge impact cash flow for healthcare practices and larger organizations. The way we think about cash flow is the capture of patient payments so that it creates transference. It's moving finances in so people can pay for expenses like personal protective equipment, rising inflation, and wage increases. It's trimming a day in accounts receivable to help people make payroll. In other words, it's all about ease and efficiency. So let's dive right into the questions. The first question, when companies take a step toward unifying payment options and adopting user-friendly payment and engagement technology, they've reported to have seen a fast return on investment. So Brian, in light of many healthcare organizations' robust investments in software like our Practice Management Bridge, can you comment on how these software solutions affect their cash flow?
Michael, absolutely. The immediate return by implementing contactless solutions is increased collection rates. That's the first thing that a provider will see the second contactless software is put into place. We have seen consistently an increase in how patients are paying, and that's digitally. When we think about that, we think about things like Amazon and Netflix. So by a healthcare provider offering those functions, the consumer is more comfortable and feels more at ease in making those payments. Something as simple as Apple Pay. A consumer or a modern patient will make a payment faster. So first and foremost is increased collection rate. The second thing we see is reduced days in AR. So the consumers, the market, are dictating things like card on file, text to pay, digital e-statements. The days of paper statements, send out a bill, let's hope they cut a check and send it back, are dwindling. And that's a really good thing for not only the provider, but for the patient experience as well. So things like QR codes are back. Transparently, I never used a QR code until COVID happened, and now they're everywhere. And that's the same concept in today's healthcare environment. We want to put a QR code on our paper statement. We want a QR code in our operatories or exam rooms. We want to make it as easy and convenient for a patient to pay as possible. And then lastly, what we're seeing is by implementing automation or technology inside the provider's offices, the providers are now allowed to allocate FTE hours to what they really should be doing, and that's taking care of the patient anyway. So when you combine those three aspects, and that is increased collection rates at the time of treatment, reduced days in AR or quicker access to cash, and then reduced FTE hours and efficiencies, that all equates to better cash flow for the provider, quicker access to cash, more growth potential, lower days in AR. And that's what digital technology is doing in today's healthcare environment.
Great, thank you for that, Brian. I think, the next question will be, we've heard from a lot of our consumers that we believe are early adopters of technology about their enthusiasm. And when we survey them, they tell us how pleased they are with technology like our Practice Management Bridge and how they wish they would have adopted it sooner. What do you hear, Brian, from people after they adopt Practice Management Bridge? What are the effects?
Yeah, great question. The immediate feedback we get is improved efficiencies. That is the number one thing we hear the minute Bridge is implemented within the market. This is long-term. The technology we're using in our retail experience has been around in our day-to-day life for years. They're not going away. We are going to pay in these modern technologies and what Bridge offers from now until something drastic changes, which we don't foresee happening anytime soon. So not only is technology increasing the efficiency within the provider's office, which is very important, it's improving the patient experience. And the patient experience is directly correlated to the amount of revenue a provider's office will generate. So that's the immediate return that we're hearing once Bridge is implemented, and that's efficiency.
Great, thanks. And with efficiency, I'm assuming that this leads to practice administrators, office managers, and providers getting more time back. And I'm wondering, what do you think these practices do with more time?
A provider gets into business to provide healthcare. They do not get in business to send out bills or try to collect money. That is not what they went to school for, is not what they're trained for, and it's not what they got into the business for in the first place. So the biggest value to a provider, and then therefore their staff, by implementing contactless digital new age technology, is allocating those FTEs to what they're there for, and that's patient care and patient healthcare. That is the most immediate and impactful piece of this software that we can put in the market. So they're taking FTEs and putting them more toward the patient, making them patient-centric, making the healthcare the priority again, not spending time calling, taking calls, fielding calls, and billing.
Great, thank you so much. This has been so incredibly useful. Thank you very much for joining us today, Brian. And yeah, to all of you listeners, please be sure to visit our website for more information about Rectangle Health's technology. Thanks so much.